Executive member of the Guyana Equality Forum, Joel SIMPSON, contends that to alleviate occurrences of suicide, there is a need for compound counseling services, more specifically counselors who are trained and qualified to deal with mental issues. According to SIMPSON, Guyana has an insufficient amount of trained counselors and psychiatrists to deal with the volume of mental health issues. SIMPSON emphasized that counseling is an important element to suicide prevention and mental health issues. He said what is needed is a strong collaboration among NGOs, government, and other human rights groups to provide the support needed.
That's a big issue. So human resources are limited, especially in civil society organizations which depend heavily on donor funding to carry out its work. This is an area where the government needs to step up.
SIMPSON further opined that the training of persons in the field of mental health is direly needed. He pointed out that it was only recently that the University of Guyana launched its psychology program, and this could take some time before specialists are made available.
So there aren't very many qualified counselors and psychologists around. International agencies like the British High Commission certainly have a role to play with this Shibning Scholarship by providing more support for students to go and study clinical psychology and those kinds of disciplines where they could come back, certainly lecture at the university so that the country can produce more psychologists. One of the huge issues that we have with suicide and mental health in Guyana is that we don't have the minimum number of psychologists per capita.
But SIMPSON was questioned about the work of several faith-based organizations, especially those from the Christian community, that provide counseling services to organizations like the Guyana Police Force.
Could you say whether or not you've taken initiative to use maybe the faith-based network? Because I know they have a lot of counselors there, but have you tried using them as a mechanism?
So we know that there's some mechanisms in the faith communities, but also there's a need for training there. And a lot of the faith institutions rely heavily on theology as opposed to the actual science of counseling psychology. And from experience, we know that what is needed is actually clinical therapies for persons who are suffering different kinds of mental conditions, including depression and so on.
Javon Vickery, HGP Nightly News.